Good afternoon and welcome. As folks are logging on, I'll give it just another minute or so and then we'll get started. All right, good afternoon, everyone. Thank you again for joining today's webinar on using data to advocate for infants and toddlers experiencing homelessness in Pennsylvania. We are so thrilled that you could join us for today's discussion. My name is Erin Patterson. I'm Director of Education Initiatives at Schoolhouse Connection. And before I get into introductions, I just wanted to go over a few housekeeping reminders. Today's webinar will actually last 1 hour. Apologies for that typo. Your audio is muted, so we ask that you share any questions through the Q&A box on your Zoom. We will reserve time at the end of today's presentations to address your questions, so please feel free to share throughout. Today's session is being recorded, and you will receive a follow-up email after today's webinar with the recording, PowerPoint, and any other resources. If you are not familiar with Schoolhouse Connection, we're so glad that you joined today's webinar. A little bit about us: we are a national nonprofit advocacy organization, and we are committed to overcoming homelessness through education. And we are very intentional about that mission. We know that research shows the more education a person is able to attain, the less likely they are to experience or continue experiencing homelessness. We also know that schools, early childhood programs, and institutions of higher education are often the first and sometimes the only place where a child or a young person and their family are identified as experiencing homelessness and connected to really critical supports in addition to being able to continue their education. Schoolhouse works in a number of ways. We provide practical assistance to early childhood programs, K-12 school districts, and institutions of higher education. We work with state legislatures to advance policies that help families and help children and youth experiencing homelessness continue to access education. We also work at the federal level, advocating to Congress and with federal agencies on behalf of students experiencing homelessness. And we always say the jewel in our crown is our network of young scholars who we support financially and with case management support to continue their post-secondary education. We encourage you to check us out, schoolhouseconnection.org. You can sign up for our newsletter, which goes out about once a week. We try not to bombard you with emails, but that's where you'll find a lot of our resources and updates. For today's webinar, I am thrilled to be joined by two advocates and leaders in Pennsylvania. After I give a brief overview of the issue of infants and toddlers experiencing homelessness, we'll turn to Omari Bay, who is the manager for building early learning links at HOPEPHL, which was previously People's Emergency Center in Pennsylvania, which many of you are familiar with. And he'll share about using this data on the ground in a local context. And then we'll transition to Tracy Duarte, who is director of the Pennsylvania Head Start State Collaboration Office, and she'll be able to tell us how she's used this data to advocate at the state level within her agency with others to make sure that families experiencing homelessness can access early learning opportunities. So a little bit about our topic today. And again, you will receive these slides in email follow-up, and we encourage you to ask any questions in our Q&A box today throughout, and we'll be sure to pause at the end to address those. First, we want to do some level setting. When we're talking about infants and toddlers experiencing homelessness, we are using the McKinney-Vento definition of homelessness. Many of you may be familiar with this because you might be a homeless education liaison in your school district, you might be a Head Start enrollment director, you might be someone else who is well-versed in making these determinations. Others might not be as familiar, so I want to make sure that we are all coming into this with the same understanding. When we say homelessness, we're referring to children and youth who lack a fixed, regular, and adequate nighttime residence. And all of those three things are important. This could include living in cars, parks, or abandoned buildings. This also includes substandard housing. It could be living in an emergency or transitional shelter. This includes domestic violence shelters. You could be working with a family who's living in a motel because they can't afford to pay their rent. Could be a hotel or trailer park as well. And importantly, in fact, the largest group of children and youth experiencing homelessness that we see are those who are sharing the housing of others due to loss of housing, economic hardship, or for similar reasons. And you may hear this referred to as doubled up or couch surfing, but these are children and families who are living with others, usually in circumstances where their dwelling does not meet the fixed, regular, and adequate criteria. I want to note that this definition is used across multiple agencies. So when we're talking about serving children and families experiencing homelessness, this includes requiring K-12 liaisons at the school district level to identify and refer these young children to early childhood programs. This also includes, and we'll hear Tracy go into more detail later, Head Start and Early Head Start grantees, where children experiencing homelessness are categorically eligible. This also applies to our childcare providers. Childcare regulations prioritize the use of funds for families experiencing homelessness. And this does include our HUD homeless assistance providers as well. It requires those programs to designate a staff program to ensure that any children are referred to and enrolled in an early childhood program and a school. I want to take a moment to really emphasize the hidden nature of doubled up homelessness when families are sharing the housing of others. First, to note that families often stay with others temporarily because perhaps there's no shelter availability in their community. This is something we hear often in rural settings where there are no available shelters. It could be because a family is afraid that if they go to a shelter and report that they are experiencing homelessness, that they will somehow get in trouble and that their children might be taken away from them, which is absolutely not true. But still a very valid fear. It's important to note that families, when they are staying with others, it puts them in a vulnerable position. It could lead to human trafficking. It could be a single parent staying with an abusive partner because they are afraid of being kicked out and going to a shelter. But this is a traumatic experience, both for the adults and for the children during a time when development is critical. And so it's important to note how our hidden homelessness can really impact young children. Also, just want to mention our definition of unaccompanied youth is important here because this could include young people who become pregnant and are kicked out of their home or forced out of their home. And so if you're working in communities with people experiencing homelessness, with young people experiencing homelessness, it's important to note that not only is it critical to ensure they continue their education, but now it's a two-generational issue, and ensuring that their young children have access to early learning is important. A little bit about what we know about infants and toddlers experiencing homelessness. According to the 2018 to 2019 program year, there were about 1.3 million babies, toddlers, and young children under the age of 6 experiencing homelessness. That's from the U.S. Department of Education. Additionally, 44% of young women who are experiencing homelessness between the ages of 18 and 25 were current or expectant parents to 1.1 million young children. So there again, that overlap between our older youth who are pregnant or parenting and our infants and toddlers. And it's important to call out here, this also includes 18% of young men who are experiencing homelessness, who are also current or expectant parents to 1.1 million children. I don't think we call out the role of young fathers enough, so wanted to be sure to emphasize that. We also know that 15.4% of infants and toddlers live in crowded housing, which is known to jeopardize child development, as we mentioned earlier. And in fact, 2.9% of babies and toddlers have moved 3 or more times since birth. And that high mobility can cause developmental impacts. We also know that Hispanic, American Indian, Alaska Native, and Black babies have a higher incidence of living in crowded housing. And then our low-income babies are nearly 3 times more likely to live in crowded housing. Just a little bit about the consequences of homelessness among young children. Homelessness in infancy has been found to be associated with delays in language, literacy, and social emotional development. We know that the younger and longer a child experiences homelessness, the greater the cumulative toll of negative health outcomes. And then those impacts can be long lasting and can be seen even after a family receives permanent placement in a home. A little bit more about the long-term impacts. We know that the high school graduation rate for students experiencing homelessness is the lowest of all student groups. So when you break down high school graduation rates by race, ethnicity, low income, students with disabilities, English learners, it's our students experiencing homelessness who still lag behind because their education is more likely to be interrupted by homelessness. We know that high school students who experience homelessness are 10 times more likely to become pregnant or to get someone pregnant. So there again, that 2-generational impact. And again, just emphasizing the developmental impacts that it could have on young children. So for these reasons, it's even more critical to ensure that young children in particular who are experiencing homelessness have access to high quality early learning, because it can help mitigate those traumatic effects, the developmental delays, the social emotional development. However, families experiencing homelessness experience lots of barriers to being able to access these programs. It could be because they're highly mobile, they're moving from one service area to another and can never access a program continuously. Perhaps it's lack of documentation. A lot of our programs require a birth certificate, immunization requirements. Some require proof that a parent is working. That can be challenging for families experiencing homelessness who may have lost these documents in moves or who may not have been in a stable enough position to access these services. Lack of transportation is one of the biggest challenges that we hear for all families and children, but particular for families experiencing homelessness. And we also see a lack of awareness among our early care providers of both the definition of homelessness, that it does include those doubled up families, and then the best ways to reach families that are sensitive to their situation, don't scare them away, and help them understand that there are resources and supports available. In light of all this, Schoolhouse Connection wanted to see how are families with infants and toddlers experiencing homelessness able to access early learning programs. And so we did a data analysis that we released at the end of last year, and we'll share the link in just a moment. But the next couple slides just summarize some of the big picture takeaways, which aren't surprising to many of us who work in this field, but having the concrete data is a huge step in making progress. So just a little note about how we calculated some of these numbers. Our population estimates were calculated using the first grade identification percentage in the states that we analyze. That's because we know that our K-12 school systems are the most likely to identify families experiencing homelessness. And so we use that as an indicator and then apply that to our census estimates for the birth 1, 2, and 3-year-old age segments. In terms of enrollment and access to programs, we looked at 3 programs. We looked at our early Head Start programs across 20 states, licensed childcare programs, and home visiting, though we should note that our access to home visiting data was limited and we could only access parents as teachers. We know that many states have many more models, and so we're constantly looking for more access to data to give us the best picture possible. So a few key trends and takeaways. Across the 20 states that you can see here that we analyzed, there are a little over 300,000 infants and toddlers experiencing homelessness. Only 7% are currently identified and served by an early childhood program. And so this means that 93%, or approximately 290,000 infants and toddlers experiencing homelessness, are not being served by an early learning program. A couple things to say about this. First of all, of the 3 early childhood programs, Early Head Start has the highest enrollment rate. And I'm excited that Tracy was able to join us today to talk about, from her perspective as a Head Start State Collaboration Office Director, how Early Head Start is poised to serve our families experiencing homelessness. We also noted, of course, across the 20 states, there's significant variation in these numbers and enrollment rates, which you'll see in the full report. And I'm just going to go through some overview slides before I hand it off to Amari here. So this is just an overview of the estimated population of infants and toddlers experiencing homelessness in the states that we analyzed. And you can see the percent served there underneath them. You can see that variation everywhere from about 4% up to 20% in some places that are served. So it's a lot of variation that we're looking at. Again, childcare, early Head Start, and home visiting all have slightly different enrollment percentages, but all on the low end, which signals to us that we still have a lot of work to do to help families experiencing homelessness access these programs. We also broke it down by program, so you can, and this is all in the full report, which we'll share the link to. So you can see the enrollment numbers for childcare by state. You can see the enrollment numbers for Early Head Start by state. And then you can see the enrollment numbers for home visiting by state. So our big takeaways, number one, infants, toddlers, and families experiencing homelessness are significantly under-enrolled in early childhood programs. They are not accessing those programs, and that's where our work lies. We also know that some infants, toddlers, and families experiencing homelessness may be enrolled in a program, but they haven't been identified. And so they're not being reported. And that's really critical, because if they haven't been identified for data tracking purposes, then they're probably not accessing the full range of services available to them through these programs. And we also know that more data and better reporting mechanisms are needed to get as clear a picture as possible. This is our lens from a national organization accessing numbers that have been reported from states to federal agencies for data reporting. I'm really excited to be joined today by Omari and Tracy, because they are doing so much more work on the ground in their local and state context to really bring this data to life and to work to help families experiencing homelessness access programs. So I'm going to turn it over to Omari Bay. We encourage you again to submit your questions to the Q&A box. I'll put the link to these slides and to our report in the Q&A box, but I'm going to turn it over to Omari to tell us about his position and work on the ground in Pennsylvania. Omari?
Thanks, Erin. Thank you for the introduction. It's a pleasure to be on this panel with you and Tracy, everyone. It's a pleasure to virtually meet you. Even though I can't see your faces. I want to talk to you a little bit about the Bell Project, but first I would like to introduce myself. My name is Amari Baye. I'm the manager for the Building Early Links for Learning program, otherwise known as the Bell Project. A little bit about me. I'm originally from Philadelphia. My formal education, which I'm very proud of, began in Head Start. Then the Philadelphia School District, where I attended K through 12, and after graduation, I attended Morehouse College. I decided to bounce around a bit, taught environmental education in Maryland, and made my way back to Philadelphia to begin my social services journey. And I call it a journey because I was all over the place. Where I ultimately landed was school-based social services, then moved to train to become a family therapist, providing in-home and outpatient care, until I was tapped to support one of Philadelphia's larger family emergency housing programs. Interestingly, I found myself using the skills obtained as a therapist in my capacity as a shelter director more often than when I was actually providing full-time treatment. But caring for the needs of families experiencing homelessness is how I was introduced to the Bell Project, and became more aware of the need for programs that eliminate barriers and increase equity in many areas, but specifically early education. Next slide, please. So what is the Bell Project? Well, the Bell Project is a program that works to increase equity and access to high quality ECE for children experiencing homelessness and housing insecurity. And how do we do this? Well, we do it through several key activities. Those key activities include childcare and pre-K discussions with program providers, and by program providers, we're talking about emergency housing programs and their parents. Staff meet and greets, where we meet with shelter staff, but also early child education program staff. Enrollment drives, because we found that it's always easiest to support families when you bring all the resources to them, particularly for families in shelter. This eliminates travel and childcare barriers. Another tool we use is a shelter self-assessment. It allows for emergency housing directors to measure the developmental friendliness of their programs and identify areas for improvement. And one of the great things about this tool is once a shelter uses the self-assessment and identify the areas where they're lacking, they can tap the Bell Project to help meet those needs. So as a shelter director, one of the areas we were lacking in is we didn't have changing tables in each of the bathrooms, and we didn't have tummy time mats for children, and the Bell Project provided those. We also do stakeholder convenings. And these are just opportunities to bring providers across systems together to build a consensus about the best ways to advocate for families and meet the needs of children experiencing homelessness and housing insecurity. In addition to that, we offer free staff trainings, and often we will speak to shelter providers to find out what their staff wants to be trained in, what they're most interested in. But these trainings can range anywhere from self-care and kindergarten readiness to adverse childhood experiences, ACEs, and the ways ACEs impact children developmentally. Bell also advocates for families, and we not only participate in campaigns led by programs like HOPEPHL and organizations like First Up and Children's First, but we also advocate locally when we recognize that there are system barriers. So for example, we spoke with the ELRC, the Early Learning Resource Center, to request that there was a homelessness liaison put in place to meet the needs and support families in shelter. We made requests to change the application so that families could indicate that they were either residing in shelter by saying they were in a temporary living situation, and they could use a previous address or enter for their previous address that they were doubled up living with a family member. These things were really important because for a long time, shelters would not allow participants to use the shelter address on their application. The application had to match their ID. Next slide. So what did we find? Looking at our current trends, looking at September 2022, that period, we found that there were between 140 and 160 infants and toddlers in shelter. What we also found is that COVID significantly impacted the rate of enrollment for children experiencing homelessness. Some of the decline may have been attributed to program instability. Due to COVID protocols, some of the centers were urged to open and close their doors each time there was a case. And with little notice, this became frustrating to parents. They saw the programs as no longer being stable, and they said, you know what, I'll just keep the child home. I'll keep my kid home with me. Some centers closed for good. Other families reported they had health concerns and decided to move to family child care or just stay home with children. But it's also important to note that the school district of Philadelphia reports that 65% of children experiencing homelessness are not in the homeless housing system, and there's a need for new outreach. Next slide. So looking at our data from 2022 versus 2021, there wasn't a huge change in the number of children that were enrolled in any early child education programs. Next slide. And then when we look at the numbers for high quality, we see a difference, 17% versus 11% in 2021. So we're like, hey, I guess we're going up, we're coming out of COVID. However, next slide, when we compare the data from 2021 and 2022 to 2019 pre-COVID, we see a huge decline in the number of children attending ECE program. High quality, any ECE. Next slide. So why does this work? Next slide. Bell works. Oh, I'm sorry. We are too far ahead on slides. There we go. There we go. Okay, so Bell works for a couple reasons. It works because we have a dedicated team of ECE specialists that are knowledgeable about both the emergency housing system and early education systems. Just wanted to point this out. When you see EH, TH, and PSH, we're referring to emergency housing, transitional housing, and permanent supportive housing. These are different types of programs under the emergency housing umbrella. Also, with that dedicated team, we offer free trainings, and we collaborate between emergency housing, ECE stakeholders, including the Early Learner Resource Center, the Office of Early Intervention, the Office of Homeless Services, and the School District of Philadelphia. Next slide. Now, taking a look at the numbers of infants and toddlers in Philadelphia from 2018 to 2020. I just wanted to use this graph to kind of inform the list of challenges that we have, the list of challenges that we've identified. Next slide. Right now, there are 45,523 infants and toddlers living in Philadelphia. And those 45,000 infants are essentially competing for 23,000 slots. The average cost of care ranges from between $660 to over $2,300 a month. However, the reduction of early child education slots disproportionately impacts families experiencing homelessness because of the first come, first serve nature of these programs. I mean, money talks. A lot of small businesses are not able to care for children without the resources to do so, right? So priority is often given to families that can privately pay for care. One of the other issues, much to Aaron's point earlier, is that there are differing definitions of homelessness. The education and emergency housing systems are reporting different numbers. The HUD definition versus the McKinney-Vento definition. It can be confusing and create blind spots as it relates to the best ways to serve homeless children and youth. Without that shared understanding, then the system kind of looks like Swiss cheese. It catches some, however, the rest fall through the hose. Another thing that a lot of parents mention is that they aren't comfortable enrolling children in the care until the child is old enough to talk and let them know what's going on. And that kind of confirms some of the work done by Dr. Maureen Hayes, who consults with us on our Bell PSH program, where she found that parents kind of lack trust in the ECE system. But overall, the reduction of ECE slots and the cost of care have made the number of infants and toddler slots scarce. Next slide. And we always want to say thank you to our funder, Vanguard Strong Start for Kids, and the William Penn Foundation, and United Way of Southeastern PA and Southern New Jersey, because they fund our work. And Bell has now expanded from just Bell Emergency Housing and Transitional and Bell PSH to an Everyday Learning Play Spaces grant under the William Penn Foundation, which allows for the installation of child-friendly spaces and playful learning installations at each of the city shelters. And I will pass it over to Tracy. Thank you very much.
Thank you, Omari. Good afternoon, everyone, and thank you very much for being here this afternoon. I'd like to start by thanking Schoolhouse Connection and Aaron Patterson for giving Pennsylvania this opportunity today to share some of the activities that we've been working on. And it's certainly an honor to be here. Next slide, Aaron. So what is the Pennsylvania Head Start State Collaboration Office, or HISCO for short, as we call it? First, I just want to start by saying that there is a HISCO in every state. They are typically staffed by one full-time director. The offices are funded by the Federal Office of Head Start and are typically located in a state office of early childhood, a Department of Education, Department of Human Services, or sometimes at the governor's office. The HISCO director's primary role is to act as a liaison between the Federal Office of Head Start and, in the case of Pennsylvania, the Office of Child Development and Early Learning, or OCDEL. I also serve in Pennsylvania as the liaison between all of our federally funded Head Start and Early Head Start programs and OCDEL, as well as other Pennsylvania state government agencies that also serve young children and families. A quick note in terms of Pennsylvania's Head Start and Early Head Start programs. Pennsylvania serves approximately 35,000 Head Start children and 9,500 early Head Start children. So those numbers alone tell you that infants and toddlers are not being served at nearly the high numbers that our preschoolers are. We also serve 700 pregnant women approximately in early Head Start. And of all of our Head Start and Early Head Start programs, only about 6.1% of children experiencing homelessness are being served. So we definitely have a lot of improvements to be made. A word about Early Head Start. Early Head Start serves, like I said, pregnant women and children up to age 3. The Early Head Start programs typically provide family-centered services for low-income families of very young children. These programs are designed to promote the development of children and to really enable their parents to fulfill their roles as parents and to move toward self-sufficiency. Early Head Start programs provide similar services to the preschool Head Start programs, but they're tailored to meet the unique needs of infants and toddlers. They promote the physical, cognitive, social, and emotional development of infants and toddlers through safe and developmentally enriching caregiving. Our services are all comprehensive. So we serve the whole child and the whole family in Early Head Start, which is why we believe we are the best and first match for most children experiencing homelessness, because they can receive all of those comprehensive services, including infant early childhood mental health, to help ease their burden as well as their parents' burdens in the best way possible. Next slide, Erin. A few words about the collaboration between my HISCO office and HOPEPHL. You just heard from Omari as he shared with you really just a small portion of the work that's being done in Philadelphia by HOPEPHL. The HISCO has been working collaboratively with HOPEPHL for about 8 years now. I'm going to say primarily because the work that they do has really just been a great source of inspiration for me as well as many of my colleagues. Just a few of the things that we've teamed up together to do. First, Joe Willard, who's the Vice President of Policy at HOPEPHL, and I began the Pennsylvania Early Childhood Homelessness Stakeholders Group in 2017, and we've been working together with that group ever since. We also worked together along with Dr. Grace Whitney to collect data and generate reports on young children experiencing homelessness. HOPEPHL has been a significant partner in analyzing and reporting the most recent data and in exploring potential state-level policy discussions, as well as collaborations throughout the process. I do sit also on the Policy Advisory Committee for HOPEPHL, and I'm able to bring a statewide as well as OCDEL purview to those meetings and to the agenda. Finally, we have collaborated on an annual Bell Summit that highlights the work being done, not just in Pennsylvania, but throughout the country. We bring in speakers to share innovative work that's being done and collect recommendations from participants for additional work to be done in the future for Pennsylvania. Next slide. Okay, so in January of 2021, the Pennsylvania HISCO began a deep review of data, state policies and practices in collaboration with Dr. Grace Whitney, who has served as a consultant to the HISCO as well as to HOPEPHL for the last 2 years, and Joe Willard from HOPEPHL. Together, we looked at Head Start and Early Head Start Program Information Report data collected from the HISCO Needs Assessment, data from the Pennsylvania Department of Education for children and youth experiencing homelessness program, and other state systems such as our continuums of care, early intervention, and child care subsidy. The result of this work is contained in the 3 reports that are listed on the slide. I won't go into a lot of detail about the data today, but the reports will be made available to those on the webinar in the PowerPoint. Some of the key takeaways from the data reports are, we know that both Head Start and the Pennsylvania Department of Education serve a significant number of children identified as meeting the McKinney-Vento criteria. They provide the only systemic and generally reliable early learning data and the only consistent data points over time in the Commonwealth. I will also note, important to this topic today, that the vast majority of the children that they identify in Pennsylvania as homeless are preschool aged. Infants and toddlers experiencing homelessness are far less visible in early learning data and overall in the realm of young children experiencing homelessness. So that is something that certainly, as Schoolhouse Connection dives into the infant toddler data, Pennsylvania will be doing that alongside with them, certainly using the data they've put out already. And then as we move forward, I'll talk about in a few slides later how we are going to also try to really dive deeper into specific infant toddler data. We also know trend data indicate that although Head Start is primarily and Early Head Start are primarily early learning programs, the family service teams in Head Start and Early Head Start provide substantial housing supports also for families. Trend data for PDE, or Pennsylvania Department of Education, indicate a steady and notable increase in the number of young children identified each year through public schools. And finally, we note that staff responsible for identifying children and entering data related to housing status are often unaware of federal and Pennsylvania OCDEL reporting requirements, as well as McKinney-Vento definition, especially in programs outside of our Department of Education and sometimes even Head Start. Next slide. When collecting and analyzing our data, we did run into some challenges, many of which you are likely to be familiar with already. These are discussed in the state brief, but to summarize, a few of the challenges we ran across are differing definitions used by different systems, such as McKinney-Vento versus HUD definitions. Provider eligibility staff have limited knowledge sometimes of the McKinney-Vento definition, specifically when it pertains to doubling up. Data collection methods are often different from one system to the next. And time periods of collection are often different and overlapping. For example, a calendar year versus varying different fiscal years. And this can make it difficult sometimes and challenging to collect accurate data. Next slide, Erin. So after collecting the data and having Dr. Whitney finalize the data report along with HOPEPHL, formerly known as People's Emergency Center, we really came up with 2 main broad goals that we wanted to begin working on immediately. One was to engage providers to learn together through communities of practice by providing education and training to all systems regarding McKinney-Vento definition of homelessness. Based on our conversations with system leaders in the state, we knew that those providing supports to our early education programs were in need of training on the definition, on eligibility policies, as well as available accommodations. The second main goal was to increase that number of children experiencing homelessness that are enrolled in Head Start, Early Head Start, and other high quality early learning programs. We learned from the data in Pennsylvania, as I mentioned earlier, in our 18-19 program year, 64% of children 0 to 5 in Pennsylvania experiencing homelessness were either not served or it was unknown as to whether or not they were being served. As Aaron stated earlier, we do believe that Head Start and Early Head Start and other early learning programs are in fact serving children experiencing homelessness, but they are not being identified and therefore documented and reported. So we think we're serving more than the data shows. We just have to sort of help our program staff identify those families and get their status documented so it's part of the data. Next slide, Aaron. Thank you. This is just a list of the system leadership that we engaged prior to moving forward with our training and communities of practice. We really wanted to hear from leadership so that we could get buy-in. We could find out what policies are in place, what practices are in place, what training is already being done for system providers and those who support providers across the state, as well as figure out exactly what additional needs they might be able to identify for us. Next slide, Aaron. And this is the list of system partners that were provided a minimum of a 2-part community of practice. These were provided by Dr. Grace Whitney. Each community of practice required collaboration with the system leadership, as well as a review and summary of all the system policies, documents, and data. Areas of need were identified, which were then guided, the content of each training and technical assistance opportunity. For our staff, participants were encouraged to explore ways to enhance their practices, to eliminate barriers to access and participation, as well as to better engage families and children experiencing homelessness. All of this in order to strengthen program capacity, to recognize and address the housing needs of families, and to better track homelessness as it impacts children, families, staff, programs, and community partnerships. There are a number of key takeaways from these communities of practice, but due to time constraints today, I won't go over them. But again, they can be found in the summary report that will be made available to you. Next slide, Aaron. This is a link to the summary report that I'm referencing and just a visual, so you'll know what you're looking for. But we encourage you to access the report, and if it makes sense for you in another state to use that as a model, we encourage you to do that also. Next slide, Aaron. Thanks. So moving ahead, OCDEL as well as the HISCO. OCDEL has continued, a contract with Dr. Grace Whitney again for the year of 2023. So we're thrilled to have her back with us for another year. We will also continue our collaboration with HOPEPHL and the staff there. We're currently finalizing a 3-year strategic plan that's being developed with consultation with our Pennsylvania Early Childhood Homelessness Stakeholders Group. Some of the tasks that we hope to be able to complete this year is to update and re-release that original brief on the data. We want to update the data. When we update it, we're also going to add sort of a carve out with a focus specifically on infant and toddler data. We'd like to develop and publish an additional brief that's focused on health data and health system supports for young children and families experiencing homelessness. We've added a health lens to all of our work that we plan to continue into 2023 and beyond that. And we want a real focus on the social determinants of health added to all of our work. We are going to complete a second round of communities of practice with Dr. Whitney and do a deeper dive into the needs of support staff in Pennsylvania and how we can continue to support them in their work. We will do a series of statewide face-to-face roundtables in partnership with our 8 regional PDE coordinators as for the Education for Children, Youth, and Experiencing Homelessness group. These will bring together that PDE ECHIA staff, McKinney-Vento liaisons, and our managed care organizations to strategize ways to support young children and families experiencing homelessness in each region. And we're very anxious and eager to hear how our managed care organizations can provide support to this work. We want to coordinate some activities with our Pennsylvania Infant Early Childhood Mental Health Consultants to provide assessment, training, and supports to our family shelters across Pennsylvania. And finally, we'd like to take the work that's been done by the Bell Project that Omari talked about and facilitate the utilization of the early childhood self-assessment tool for family shelters and family shelters across the entire state of Pennsylvania that serve children under 5. Next slide, Erin. So thank you. To conclude, we know that educating our providers and the systems that support them are the first step to improving services to children and families experiencing homelessness. The more aware they are of the definitions, policies, and accommodations, the more likely that children and families will receive what they need, including high quality early learning. We are also aware that without the support of OCDEL, we would not have the ability to weigh in on policy and make recommendations that are truly being heard and resulting in changes that are taking place to better serve our most vulnerable children experiencing homelessness. So again, thank you. I'm happy to take any questions or comments today, or please feel free to reach out to me via email if you'd like more information or have questions after the webinar. Thanks, Erin.
Thank you both, Tracy and Omari. That was just amazing in terms of the information you've been able to share and the work that you're doing to increase these enrollment rates and services for infants and toddlers experiencing homelessness. We do have a number of questions coming in, so I'm going to do my best to manage and direct those. First, I do want to acknowledge we had a thank you come in to the Q&A box just saying thank you for taking the time to mention the mental health and support needed within early childhood education. I do think that's important to call out, and you both address that so well. So I will echo my thanks for that. I want to start with a question there are a couple Pennsylvania specific questions coming in. And so I'm going to first encourage our audience. We'll put up email addresses in just a moment. So definitely want to encourage you all to reach out to Omari and Tracy directly, if that's okay with you all. We might flood your inboxes, but I know that you all would love to be a resource. And there are a couple questions that I want to lift up to have you both speak to that I think can be good generalizations for our audience as well. So Tracy, we had a question come in, and I want to go to you first, and then Omari, you might be able to speak to this connection as well. The question is, how does the HISCO office collaborate with the McKinney-Vento state coordinator in their office, like a homeless education program?
Sure. Thank you. That's a great question. When I talked about our Education for Children and Youth Experiencing Homelessness regional coordinators and that program, those all are contracted through our Pennsylvania Department of Ed homeless education program under our state coordinator. So they are all a part of that PDE program under the state coordinator, and the state coordinator is a part of our Pennsylvania early childhood homelessness stakeholders group. So it's a lot of words and a lot of acronyms, but it's all under our state coordinator and the work that gets done out of the Department of Education. I hope that helps answer your question.
Thank you for that. And Amari, I don't know if there's anything you want to add about connecting with your local K-12 partners as well.
No, actually, I think Tracy nailed it, but one of the things I would say, is find out what the parent resource, component is to each of your school districts and have a conversation with them. Many of the programs, so, ECHIA is statewide, but many of the schools have, it used to be called parent ombudsman, but they have some outreach coordinator that will go out and actively recruit children for programming. I think linking with that person and finding out what other programs they're tied to is always a great way to not only get children enrolled, but to advocate on behalf of children and families.
That's great. Thank you. Omari, I have a question or two that I want to go to you first and then open it up to Tracy for additional information. Again, this is a Pennsylvania specific question, but I think your answer can be helpful to our audience from other states. This is a audience member who works in a transitional shelter in Chester, Pennsylvania for women and children. Almost all children are 4 years old and under and have not received pre-K or childcare services. So the question is, how can I as a service provider connect with OCDEL and other McKinney-Vento liaisons to ensure access by our residents and receive these supports? So I wanted to start with you, Amari, and then we'll open it to you, Tracy.
So I think part one kind of speaks to the previous statement that I just made, which is connecting with the local school district to find out what programs are available for children to be enrolled in and see if they will send a representative out to actively recruit. However, I would want to ask, are there Head Start programs in Chester, PA that could serve the families that you care for? And I guess it's a question directly to the audience member who can't respond live. But if they would like to email me directly, then we can definitely flush it out and look for some supports that are in the area. But to you, Tracy.
Totally agree. I would say email me or Omari. I can certainly connect you to your Chester County, Pennsylvania early Head Start programs. That would be the first place I would look to. We also have early learning resource centers in Pennsylvania, which is our child care resource and referral, as well as subsidy offices. There's 19 of them across the state. They are also a great place to go. But you're always, so there's different avenues, there's different doors you can go through. And emailing me is certainly one of the options. So we'll get you definitely hooked up.
Thank you both for that. I promised you we would fill your email inboxes. So I think that you're going to start to see a lot of questions come in. I will say, just to address that from a national perspective, other things we're seeing in other states, if you are a shelter or other community-based service provider, you can assess your existing MOUs or develop a memorandum of understanding that's in place with your local Head Start, childcare, and other programs, so that when a family does enter your shelter or program and they have a younger child, you can be sure to automatically refer their information to your local early childhood provider to make sure they do get at least outreach and understand what services are available for them. Omari, I want to start with you for this next question as well, and then Tracy, you can speak to it from a statewide perspective. The question is, to what extent are the lower numbers in childcare related to childcare closures during COVID, and are all those slots back open now?
Wow. So that is a multi-level question, but I will try to answer it in parts. So are all the childcare programs back open? No, some of them are closed permanently. They could not survive COVID. Another thing that is impacting the slots available to children is staffing. A lot of programs are experiencing significant staffing shortages, and it's meaning that classrooms are closed, and as a result of classrooms being closed, there are less spaces for infants and toddlers. Another thing is the cost of care has skyrocketed. It was high when when I first became a parent, but by the time my fourth child was born, care was through the roof. So the cost of infant toddler care is the highest child care cost of all categories of children. So I'd imagine the state of the current economy, the fact that we're just coming out of COVID and programs have closed, and the lack of staffing, I think all of that is probably driving demand for these programs and for these slots.
Tracy, anything else to add about those lower enrollment rates and the impact of COVID?
No, I think that's really a hard question. The one thing I would say is that our rates were low before COVID. So while I know they everything was worse during COVID because of closures, to me, that's aside from the fact that we still have a lot of work to do. Yeah, so most of the numbers that we looked at were pre-COVID numbers during, because in Head Start, they didn't require a program information report data from programs during the first year of COVID during 2020. So we didn't even have that data to look at. So all of the data that, at least from our perspective, that we collected that shows very poor numbers for children experiencing homelessness being connected to early learning are all pre-COVID numbers.
Thank you both for that. We're running short on time, and I will turn back to you all in just a moment to give you the last word. We have a couple questions coming in. This one I can't let slip past us without addressing it. This is from a K-12 school. It says, for Head Start referrals, can we report automatically to Head Start programs when we have homeless children ages birth to 5 who are siblings of or other enrolled children, or do we need the family's permission to refer? That is a great question. I have to remind everyone that not only can you refer, but our K-12 homeless education liaisons are federally mandated to identify and refer those younger children experiencing homelessness to your early learning partners. Head Start, early Head Start, childcare, early intervention, any program that might be able to serve those families. And in fact, Schoolhouse Connection is piloting a referral app in Pennsylvania, as well as some other states. Thank you, Pam, in Nevada, for also bringing that up where we are piloting. And that referral app helps those liaisons connect directly to their local Head Start or early Head Start program. So I'm happy to share more about that if you want to email me after. There's also some information on our website. In terms of needing the family's permission, we always recommend letting the family know, asking if it's okay to share their information. But because the child is not enrolled in a K-12 school district, they're not technically covered by FERPA. So there's no violation there, but we always encourage you to check with your local school district and superintendent on those policies. So we definitely want to help increase those referrals. We have an app to do that, and we'd be happy to share more. In our last 2 minutes, first of all, I want to thank our audience. You have been so attentive and engaged. I'm going to put up the email addresses for Omari, Tracy, and myself. I think there's a lot of folks from Pennsylvania in particular who would like to find out how to be more involved. And so that's really exciting to see. But in our last couple minutes, I want to turn to you both, and Tracy, we'll start with you. I want to give you all the last word, knowing that you have a captive audience and we're trying to increase enrollment in services to infants and toddlers experiencing homelessness. What is the action that you would encourage folks to take that they can start with today or tomorrow where they are?
I would say ensure that your staff, all of your staff, from leadership to direct provider staff, be knowledgeable about the McKinney-Vento definition, be knowledgeable about the eligibility criteria for programs and services available in your area. There are a ton of resources out there available. There's a series of 9 modules out there. We'll make sure we get those out, Aaron. I can put them in my PowerPoint or send them out. So there's lots of resources, and I think the best place to start is to help us make sure everybody is aware of McKinney-Vento definition. And if there's a way we can support you, I encourage you to email me, and I'd be happy to either support you myself or get you in touch with folks that can do so as well. So that's my 2 cents, Aaron. Thank you.
Thank you, Tracy. Omari?
All right, I'll try to make it short. It's hard to follow that up. So first thing I would say is, we all work in a human service field. So let's remember the human part of it, right? Childcare is not a one-size-fits-all model. We know that families have their own reasons why they enroll children or don't enroll. and we have these ideas about what is quality and what isn't, and what's a good space and what's not. But I think we should remember to take the time to speak to parents and families and find out exactly what they are looking for. Because in doing that kind of work and in doing coalition building with different provider partners, you may be able to put together a group of resources that better meets the needs of children and families in your program in a way that isn't necessarily spelled out in someone else's standard.
That's the perfect word to end on. Tracy and Omari, thank you both so much for your time and expertise. Thank you again to our audience. You'll receive a follow-up email with this recording as well as the slides and resources that we've mentioned today. I hope everyone has a wonderful afternoon. Thanks you all.